Senior Emergency Dr. Emma West is standing by for a critically ill car crash victim being rushed in by chopper.
That's fine.
You can go from the helipad straight down to
Yeah.
trauma.
Okay.
Try and get him to see
Yes. Yeah. Good. Awesome.
I think we're going to need to give this patient urgent, massive transfusion of blood product because blood pressure is so low. They're clearly very badly injured and they're going to need help urgently. Do we go now? Yeah. Just going up to the helicopter pad because he's unconscious, he's got chest injuries, he's got low oxygen level and his blood pressure is critically low and he's actually at risk of arresting or dying. It's pretty unusual for us to need to go up to the helipad, but if there's ever a call to need to go up, this is the patient that you do it for. I'm worried that he could arrive and we may have missed our chance, but hopefully not. It sounds bad, unfortunately.
Hi, Emma.
Tim, how are you? Let me know how I can help you.
Just 4 units of,
I thought you might be MP by now. Yeah. It's a female or male patient?
Dr. Emma needs to focus on the patient's breathing and massive blood loss.
Lungs collapse, hypoxic,
perhaps down with 5.
Oh. It's a touch and go situation that I'm faced with. It's really very desperate. This patient has a blood pressure that's so low that their life is hanging in the balance in every moment. She's on her 5th unit of blood and she's on 5 of adrenaline.
At the Royal Melbourne, Dr. Emma West's unconscious patient has arrived by air ambulance in a critical condition.
I'll get someone to hang on to the tube for me, please, while we come across.
It's a pretty devastating car accident, head-on collision. There was such a long time for this patient to be trapped that I'm really very worried.
Car involved in a high-speed head-on collision. Pupils were fixed and dilated from the outset. Through most of the flight, all I had was blood pressure around 50. That was the best I could get. The adrenaline infusion has brought it up to around 80.
Thanks, Tim. Airway?
Airway is intact and still unclean.
Okay.
6 metres.
Good.
I can hear bilateral air entry on the jet.
Okay. At the moment, I'm faced with oxygen level that is critically low, and so I need to put all my efforts into figuring out a way to make them better. Have we got X-ray coming in?
Yeah, we have it.
Thanks. Okay, platelets are going in. Can someone squeeze those platelets in? And can I get the blood pressure to cycle again, please? Okay, so let's get the pelvis and chest X-ray and go to CT. Every moment counts when your oxygen level is low, and every moment that your blood pressure is low is extremely important. So we're doing some urgent investigations. One of them is a chest X-ray. Perfect. X-ray ready. If you don't have lead, hop out of the room. Hands off, X-ray. Ben, if you're able to just have a look at the chest and pelvis, or someone from your team, post securing this tube on the left is to continue blood and go to CT.
VSAT's down to 70.
Yep. Overall, this patient's really critically unwell, but my priority is to get this patient to the CT scan and figure out if there's something that we can do extremely urgently to change the outcome for her. CT aware that we're coming?
Yes, they are.
Good. Okay. What's stopping us from going to scan? Are we just fiddling with lines? You're ready? Okay. Let's go to scan. I'm really worried. This is potential for a bad outcome for this woman. I'm really worried for that because she had such a long time with low oxygen, low blood pressure and unconscious. So that's my worry, and that's probably all of our worries. CT aware that we're coming?
Yes, they are.
Good. Okay. You're ready? Okay. Let's go to scan.
Back in trauma, Dr. Emma West is treating a critically ill car crash victim who's unconscious. An urgent CT scan should show the extent of her internal injuries.
Okay, just recapping, airway's fine and is good. Just wait. Yep, good, it's coming up. Perfect, alrighty. There's a lot of people in the room. There can be a lot of noise, but that's part of my job is crowd control, to keep people quiet, because you need to be calm when you're making these type of life-saving decisions. Let's get the scan at the head at least. This woman, she was unconscious at the scene for such a long time. I'm very worried about a potential devastating head injury.
Dr. Emma has pulled together a large team of surgeons to decide if they should operate.
As you can see, he's got a big subdural over the left cerebral hemisphere.
The scan unfortunately shows there's a really significant head injury, bleed around the brain. And so this is confirming our worst fears. A lot of neurosurgeons are looking at the scans to try and figure out what can be done to help this woman. Pending whatever we see on the abdo, we'll probably go from here straight to theatre.
Not only is the brain bleed causing deep concern for Dr. Emma, but the next scan reveals another serious problem.
So there's splenic injury and fluid probably coming from that spleen.
It's going to be very difficult to assess her scot-free fluid, so I don't think we really have a choice.
This patient is bleeding internally and needs to urgently go to theatre for an operation to control the bleeding. Are you going for a laparotomy? Yep, okay, good. We're going to go directly from here to theatre. She's bleeding heavily from a laceration in the spleen. She needs it removed. There isn't another course of action that can save her life. Emma, we're speaking. We're ready to come up for trauma laparotomy. So we'll go straight up to theatre. Very, very serious, unfortunately. She's in very safe hands. She's in theatre, and now it's time for me to meet her family. And so my job is to let them know that we really care for her and that we will do absolutely everything to give her every chance of surviving. You know, you train in it, and you have to train in it because you have to do it well, because, you know, this is some of the hardest news that they'll hear in their life. Certainly, it does affect me. You feel extremely sad, but I have a job to do and I have to be there for them. It's them and their grief, and they need to know that I really care. It's more than just a job, I guess, that you're really there doing everything for their loved one. So we'll go straight up to theatre. Very, very serious, unfortunately.
Dr. Emma's car crash victim had surgery and went to intensive care. But the injuries were so critical, the patient didn't survive. It's a busy day in emergency as another air ambulance arrives with a mother of two who's crashed and rolled her four-wheel drive at high speed.
What would you like me to do?
Senior Dr. Emma West arrives to oversee the gathering trauma team.
You've got something?
Okay guys, so I've got 29-year-old Jess here, who's the driver of an 80 series Land Cruiser today. She's lost control whilst travelling about 100 kilometres an hour. The vehicle rolling 3 to 4 times, and there's significant damage to the left-hand side of the car and the roof crushed down. She's got partial amputations to her right little finger, ring finger and her middle finger.
Jess's severely injured fingers need looking at, but first Dr. Emma has to consider internal injuries.
I can see that this woman is in a lot of pain from a finger injury, and that's where all her mind is, but the car's rolled 3 times, and that's a high-speed, high-impact accident, and it's a really high risk for injury to this person, so we're pretty worried.
But Dr. Emma then finds out there's something else making Jess anxious.
She had a 4-year-old child that was secured in her car seat, sitting behind her.
4-year-old child. I have a 4-year-old. I feel for her that a child involved in the car accident. It would just be awful.
She had a 4-year-old child that was essentially uninjured and had been transported to the hospital.
Incredibly, the young daughter is going to be okay. Dr. Emma can now concentrate on treating Jess's injuries.
Okay. Jess, my name's Emma. I'm just going to do an ultrasound of your belly now, okay? And then I'll cover you up after that. She has a partial amputation of 3 of her fingers, so we really need to get going on managing that. But because of the high-impact nature of this car accident that Jess has been involved in, an ultrasound is really important. So we begin with how they're breathing. Sorry, Jess, I'm just having a look at this right chest. This looks a bit different, doesn't it? Initially, on one side, there's a concern that she might have an injury to the lung. Jess, take a big, big deep breath in. Does that hurt in your chest at all? No. Are you sore over here at all? No. Okay. And not up here? No. Okay. No worries.
Dr. Emma's getting conflicting messages. The ultrasound suggests a punctured lung, but Jess has no chest pain.
One of the difficulties with the assessment with Jess is she's had a lot of pain relief and, you know, she really needs it, but sometimes it can mask a hidden injury within the torso.
No pain in the legs?
Oh, my knee, yeah.
I just dislocated the
So you think there's a fracture in there? Okay.
Emma now needs to look at Jess's partially amputated fingers to see if they can be saved.
Jess, I'm just having a look at your hands now, okay? So you've just got a bandage on there. I just want to have a look underneath and just see what's going on, and then we can get an X-ray. And then I can bandage it back up. It feels a bit better bandaged up, does it? I'm quite worried about the reports of her having a partial amputation. And I know this is going to be really very painful for her. What's your 4-year-old's name?
Chelsea.
Chelsea. And apparently Chelsea's fine, is that right?
Thank God for that.
Yeah. I try and distract Jess by talking to her about her family. And although it's still painful, it's probably, with a bit of distraction, better than it could have been. Do you have other kids?
Oh, yes. Miss Charlie,
How old's Charlie?
7. Oh, no.
I'll just stop now. So just 2 kids?
Yeah.
Sorry, Dal. I'm going to have a quick peek and then I'm going to pop it all back on.
Oh.
You never know what you're going to see under a bandage, so you prepare yourself because how you react can have an impact on your patient. I'm just doing it very slowly because I don't want anything stuck down to cause you pain. The tips of her fingers are partially half amputated. So the finger's still there, but it's hanging off in the wrong direction. They're crushed, bleeding, there's bone and tissue on view, and her fingertips are bent the wrong way. So looking at them, immediately I'm quite worried about the blood supply. Without blood supply, her fingers could die. And then looking at how much of an open wound there is, she's very much at risk of a significant infection within the bone and her fingers. So there's a lot going on there. I'm just going to do one more thing and then I'm going to... all I want to know is, can you feel me touching you?
Yes.
And here?
Yes.
Here?
Yes.
And here?
Yes.
Are you sore over your hand? I'm not going to touch your fingers because I know your fingers are sore. Just your fingers. Okay, no worries. Sorry. When I'm not touching and it's bandaged up, is that more tolerable?
Still hurt.
Okay. Being a doctor and a mum and seeing some pretty horrible stuff at times, I can be that crazy parent that's always saying, move away from the road, you know, hold my hand. I'm always telling my husband what to do. I think just knowing that accidents can happen at any moment and road trauma is it's just horrible. And I just really hope that a horrible car accident never happens to me or my family, ever. So it's a pretty significant mechanism of injury. So 100 k's an hour, roll over 3 times, squashed roof. Thank God the kid's okay, and she's got maybe something in her leg, and trauma will chat with plastics.
With so much going on, including a possible punctured lung, Dr. Emma needs to get Jess to both X-ray and CT fast.
My head.
If she has any other injuries, I need to know about them now. It'll allow us to look inside and see what the major organs are doing. She's really at risk for injuries to even the major blood vessel of her body, her aorta, and only a CT scan will detect what could be a life-threatening injury. Okay.
Dr. Emma's patient, car crash victim Jess, had severely injured fingers after rolling her car several times with her 4-year-old daughter inside.
And apparently Chelsea's fine, is that right?
Thank God for that.
Yeah.
Dr. Emma ordered a full scan of the young mother looking for internal injuries, but thankfully it showed no damage to her lung or leg. Surgeons operated the next day on the 3 partially amputated fingers of her right hand.
She's had a really good outcome. She's been able to keep her fingers, which is really lucky, you know, to go 100 k's an hour, and it's so great that she was able to have them reattached, keep her fingers, and now be able to use them.
An air ambulance is landing on the hospital helipad with a man who's been injured in a freak car accident.
Guy in a 4-wheel drive and has crashed. He's an 180-kilo gentleman, apparently, was trapped in the car and had to be freed by the SES. And he's got back injuries. That's all we know so far.
Dr. Jenna is standing by to treat 38-year-old Brad. Pictures from the crash scene show it's a miracle he's alive.
Stay nice and still, can't you? Just let us do some work.
Whoa, head spin.
I'm Jenna, I'm one of the doctors. I'll be looking after you.
So Brad is driving a car today at around 60 k's an hour from what we can gather, and it appears like a branch or a tree has fallen down across the bonnet of his car. He's then gone down an embankment, 20 metres down the embankment, smashed through the several trees and come lodged up against a tree on an angle like that. He remained trapped in the car for probably an hour before we got there. He walked out of the vehicle, no issues, then complained of some lower back discomfort. And just as with Mandy, he complained of some soreness in his right wrist as well.
Thank you very much.
Adrenaline is our fight or flight hormone. It's designed to help us survive, and it can mask your pain initially. That's why you hear about all these patients getting up and walking on broken ankles or dislocated ankles and spinal injuries and not feeling the pain until later on. And so Brad could have a head injury. He could have, pelvic injuries or abdominal injuries.
I live with Mum.
Okay. All right. And does she have a look at the ankle?
No.
Do you care for her?
Yeah, sort of.
Okay.
With the possibility of serious injuries, the hospital is contacting Brad's mum. A former Country Fire Authority volunteer, big-hearted Brad spent his life looking after others. But now he's the one who needs support.
The CFA, they're amazing. Working in emergency services is not easy. I'm quite lucky that it's my job and, I get paid to do it, but people who volunteer to do it I think are very special. Can you take a big breath in for me, Brad?
The ultrasound is the first step to finding internal injuries, but Dr. Jenna is having difficulties.
And again. Being larger means that it can be harder to tell where the injuries are because you're having to penetrate through a lot more tissue. There's some injuries that can be time critical, and in a car accident, that force increases the likelihood of major injury, especially in the chest to the great vessels. And the one in particular we worry about is the aorta. It's quite a serious injury and the mortality is really high from it. Big breath in. Abdominal fast is negative. The chest is clear.
Finally, she can rule out bleeding to his abdomen and chest.
So, do you remember all of the accident? No, sorry, just try to put your head still. Yeah. So, what is the last thing you remember?
I don't know.
You've got some bruises on your face, so we know that you'll hit your head, and you might have lost consciousness for a while, but we're not sure. Yeah, okay.
So there's different types of head injury. They can get bleeding around the brain, and sometimes these patients will have long-term brain damage. 1, 2, 3, and roll.
All right. Any pain here?
No.
Yeah.
Starting.
Okay.
It's all in the lower back.
Yeah. So,
In the,
lower T spine, upper L spine.
yeah, it's all in here.
Okay.
The fact that he's got spinal tenderness, he's potentially got a brain injury, and also he's a difficult patient to assess at the bedside with our ultrasound. All those factors combined means that he gets a full head-to-toe scan to rule out any major injury.
Injection now, warm feeling.
In emergency, Dr. Jenna Alexander's car crash victim, Brad, is in the CT scanner. It's feared the former CFA volunteer has multiple injuries after surviving a shocking car accident.
X-ray after this. Yes, please.
While the CT scans are assessed, he's also X-rayed.
Just turn your hand out like that, Tom. I just noticed a little irregularity or an old injury in the knuckle. If you actually look at his finger, it's quite deformed. So you wonder whether it's new or...
Someone chopped it off with an axe.
When you were much younger?
8 years of age. I said, Mum, I've cut my finger. She goes, I'll get you a Band-Aid. I go, I need a bit more than a
Probably
Band-Aid.
more than a Band-Aid.
Luckily, no new fractures are found. And on the way back to the trauma bay, results from Brad's CT scan are ready.
The CT scan can see he has got a chance fracture of the L1 vertebra. So it's not as bad as it could have been, but it's something that needs orthopedic input.
Even though Brad's back is fractured, his spinal cord is intact. So rest and rehabilitation should be all that's needed for a full recovery. Brad, who's devoted almost half his life to volunteer firefighting, looks at the photos of his own rescue with a sense of relief.
They did a good job. I don't know how long the rescue took to cut me out. Don't remember much of the accident.
His mum, Janice, feels lucky to have her son alive.
Shocked.
Oh, HP.
Former CFA volunteer Brad cheated death when a tree fell onto his car, forcing him to career off the road and down an embankment. Despite fracturing his lumbar spine and breaking a tooth, he was discharged from hospital 4 days later.
Hello, it's Johnathon Papson, emergency. 1540 on the helipad. All right, thank you. Bye. 20-year-old who's crashed her car towing a trailer. She's not wearing a seatbelt. She's rolled. She's hurt her ribs. Probably has nasty injuries.
Dr. Jonathan's about to receive a young dairy farm worker who's rolled her ute in rural Victoria.
When someone's not wearing a seatbelt, it automatically ups the ante and the risk of what injuries they might have. All right, so we're going to all listen to the handover.
So this is Riley. She was unrestrained. The seatbelts don't work very well apparently in the vehicle. She hit a pothole, hit the brakes of the vehicle, and the trailer's pushed her, and she's ended up rolling at least once into a paddock onto the side of the road. My exam finds she's got quite a large hematoma on the top of her head. She may have headbutted the windscreen looking at the actual incident.
Often we don't see anything on the outside of your head, but if you've got a hematoma or a bruise on your head, it's a marker. It tells us that there's been an impact there. So we're worried about a bruise on the brain.
Right, darling. Just get you to fold your arms across your chest for us, okay? And give yourself a hug.
20-year-old Riley was thrown around the ute with incredible force, hitting her head and body.
Saw that? Yeah, saw that. No, that's okay. Yeah.
That sudden stopping force without a seatbelt is where you tear your major organs, and that's what kills people in car crashes. And did you get yourself out of the car or you couldn't get out?
I just remember, I don't remember actually crashing as such. It's just what they've told me has happened.
When we talk to patients, even from the very start, we get a sense of what their brain injury potentially might be. So within a few questions, often we get a sense that there has been a head injury. Those little subtle things that people wouldn't normally say when talking to strangers are little clues to us. So we're thinking, this isn't quite right. The thinking's not quite right here.
Dr. Jonathan orders X-rays looking for rib, limb and pelvic fractures.
Yeah, it's Jonathan. Can I get a mobile chest and pelvis in trauma, please? Is your face sore? I mean, you've got lots of dirt and stuff on your face. Yeah, did you have a blood nose or anything?
I did when it happened, but that was all.
Yeah, okay.
I can remember, like, looking in the mirror and the trailer going everywhere and I put my foot on the brake and that's all.
Riley's sketchy recollection of the accident is a sign she may have a brain injury.
We'll give you something for the pain. How bad is it now?
It's not bad when I breathe, when I'm not breathing.
Yeah.
Riley's mum and stepdad are on their way to be with her.
Very fast rollover with a trailer. It's just her flying through the air, hitting something, and that's the problem because when she hits something, that's where you get the most damage to the body. That's where the chance for lethal injury really escalates.
Johnathon suspects the 20-year-old has fractures and possible life-threatening head and spine injuries.
All right, darling. We're just going to put you onto a nicer fitting collar, okay? Perfect.
My boss came, they couldn't get me out and then the firefighters came and cut me out. It was like, help me.
Riley's parents are making the 3-hour drive to the hospital.
Oh, yeah? On the line of that. Hello?
The x-rays are inconclusive. So Dr. Johnathon orders a full body scan as he's worried Riley has serious internal injuries.
The CT scan's going to have a look at your entire spine, from your neck all the way down, and all your vital organs and everything in between. We'll be able to figure out if there is any damage to any of your internal organs or anything. Okay?
Nurse Sheridan Dobson explains to a frightened Riley what's about to happen.
1, 2, 3.
We're worried about her neck because she wasn't wearing a seatbelt. We're thinking rib fractures, maybe bruising to the lungs. We're also looking for spine injuries, and we're always worried about abdominal injury as well in someone who's been in a crash without a seatbelt.
As Riley waits alone to hear what the scans show, her biggest fear is calling her dad about the crashed ute.
Hello, Dad. Did you see the ute? Am I in trouble?
For us, in emergency, this is what we do. We see people coming in all the time with injuries, but for the patient, they weren't expecting to be coming to hospital. This has completely interrupted their day and it's interrupted her life. Who knows what consequences are going to come from this split-second thing that happened to her.
Riley's mum and stepdad have made the long drive to be with her.
It was a horrible thing to turn up to, knowing that your daughter had been in a car accident, and to get there with police cars and ambulances and fire trucks and a helicopter and people everywhere and a vehicle in the paddock. I just felt sick.
Riley must wait until scan results reveal the extent of her injuries.
It's really important to have family, especially with Riley. The constant reassuring and reorientating is pretty necessary because she might not be laying down memory very well with her head injury, and that's what we're thinking is happening.
We'll just have to wait until we know.
Did you get yourself out of the car or you couldn't get out?
I don't remember, actually.
Dairy farm worker Riley was airlifted to emergency after she rolled her ute. Dr. Johnathon worried she had fractured ribs as well as spinal and brain injuries.
Hello, Dad. Am I in trouble?
Fortunately, Riley escaped without any fractures.
Oh, she's really lucky. We don't really know what happened to her in the rollover. We don't really know what forces went through. She might have just tumbled and not actually struck anything with a great impact. She's probably been bounced around as it rolled, but we don't really know. So, yeah, she's lucky. A lot of people don't make it out of a rollover. It's a common way that people don't survive a crash.
Yeah, I'm really lucky it wasn't worse. Could be dead, but I'm not. so it's okay.
But Riley's brain has sustained damage.
Because I can't remember things, I can't make new memories, just old ones.
After 2 days in hospital for neurological tests, Riley moved to a rehabilitation centre for further treatment. She's making a good recovery and already taking tentative steps to get back to work. Up on the hospital rooftop, another urgent case is arriving at emergency. An air ambulance is landing with a young man badly injured in a car crash during cold and wet weather.
Is it really cold in here today?
It's freezing. I've had to put extra gowns on.
Senior emergency doctor Johnathon Papson is standing by with his trauma team.
Sounds like he's gone surfing, he's come back in the rain. Someone's just pulled out ahead of him and he's crashed into the side of them. He's been trapped in his car. He's been stuck in there for half an hour. Usually when it comes via helicopter, it's pretty serious. It's a serious deal. Oh, here we go.
24-year-old uni student Taylor was pinned in his crashed van in freezing conditions and is in a lot of pain.
We're going to move across and have a look at you, mate. All right? You feeling okay?
Oh, yeah.
Yeah, good.
Yeah, a bit better.
1, 2, 3. Right, 1, 2, 3.
So Taylor's normally well, driving a high ace van, T-boned a car that came in front of him. He's got full recollection of the event. He was trapped for about 40 minutes. The first ambulance crew arrived, so he was sort of spread eagle over the top of the steering wheel with his chest resting on it. There is some damage to the steering wheel as well.
Okay, all right.
Injury-wise, there's apart from a little bit of bleeding from his nose, there's no obvious injury to his face, to his head. Neck's got no pain.
Got the wound on the leg.
Is an injury in there, which looks like a bit of dashboard's gone in and out again, and just a steady ooze of blood coming out of it. He has a little bit cold because it was quite cold.
Yeah, cold and wet. Taylor's very lucky. A lot of people wouldn't survive this sort of crash, especially with the country road, high speed, wet conditions, older car, you know, roll the dice.
Taylor's father arrived at the crash site as his son was being cut from the van. His parents are on their way.
Does that hurt? No. Did you hit the steering wheel with your chest?
Oh, I'd assume the airbag didn't go off, so...
You had a seatbelt on?
Yeah.
Does it hurt when you breathe?
No.
No. Did you hit your face on something?
Probably the steering wheel.
With no other obvious external injuries, Dr. Johnathon turns his attention to Taylor's leg, which had been bent up against and then pierced by the dashboard of his crashed van.
So it's probably broken, isn't it? There's a little bit of ooze coming out.
Is that sore, mate?
No.
Looks like an open fracture bleeding. So an open fracture is where the fractured bone is exposed to the environment, which means it's just going to get infected unless you do something about it. And it's a bad thing to happen.
The injury is potentially devastating for Taylor, who works as a surf coach and has important uni exams coming up.
And your leg's quite sore, yeah?
Yeah, both of them.
Yeah, both.
What about those toes? Well, yeah, that's my big toe. The toe's really sore. And the neck.
Both toes numb? Both feet? Or one?
These are sore. Those are kind of numb.
Does that hurt?
Oh, no.
For something like this, what are the real problems going to be? It's going to be chances of infection. Is there a problem with the blood supply to the toes? Has the main artery down there been compromised by the fracture, by the bones moving? So the fast is looking normal and the chest looks normal. If it's an open fracture, which means he's got bone poking out, then there's always a potential of amputation. So there's always a potential that he's going to lose his leg. That's the real deal here. How old are you?
24.
Over in Trauma 1, Dr. Johnathon Papson's patient Taylor is waiting for the X-ray results of his right leg, which was severely injured in a car crash on his way home from the beach.
Because you're going how fast? Like 80, 100 or?
Realistically, probably 90.
90, yeah.
The X-ray results are ready and confirm Dr. Johnathon's suspicions.
So he's got a fractured shaft of the tibia, which is not a good injury to have. Because it's open to the environment, you can get an infection from there. So it's actually quite a serious injury to have. If it gets infected, that's big trouble.
It's a broken bone under there.
Yeah, right.
And you can tell because you see how the blood's like a little bit fatty? It's probably coming from the middle of the bone because it's got marrow.
Johnathon calls in specialist orthopaedic surgeon Dr. Patrick Elias to see what can be done to save Taylor's leg.
It looks like it's open, so it's a grade 1. This is a pretty significant injury, and the complications associated with this can be limb-threatening, so we need to do an operation on this as soon as we can and insert a metal rod down the bone and use some screws to secure that rod.
We're giving him antibiotics, we're going to wash it out, but there's still a high chance this leg of his is going to get infected.
Just a wave request?
Taylor's parents, Maury and Joelle, have arrived to see their son.
So you guys just give us heart attacks, you do? Which one? You and your brothers?
Taylor phoned his dad while he was still trapped in the van.
I was doing some gardening and the phone rang and Taylor just said, "Dad, I've had a bad accident and I think I've broken both my legs." I said to him, "Call an ambulance," and he said, "We already have." And then he told me where he was, so I said, "I'm on the way." Driving down there, I tried to ring him back and he didn't answer his phone. That's where I was thinking something terrible's happened. I got down there and, there were police and ambulance, everybody all around the place. And the car was just absolutely written off. He was pinned, his legs were pinned in the van and it took them a while to cut him out. They had to obviously cut the van and he was in a fair bit of pain. It was cold, it was raining, it was just a shocking day.
People lose their legs all the time in crashes like that. I've seen the van, he could lose his leg. We will do everything we can to make sure that doesn't happen.
Any questions about that?
Orthopaedic registrar Dr. Timothy Chung prepares Taylor for the major surgery he's facing.
There's some risks involved. Our hope is to give you one operation, which is rods, then recovery of about 6 months.
It's overwhelming news for the surf coach and uni student whose life will be dramatically changed by the accident.
So, what do you do for work? Surf coach, and I'm a student. So you're about 6 months away from being able to surf.
It's going to be awful for him not to be able to do what he loves doing. It's totally unexpected. It's come out of the blue. It might be totally devastating for him. That's his job.
Doctors will need a CT scan of Taylor's broken leg to see the full extent of his injury before he goes to surgery.
He's going to have pins and an external device put on his bones to hold the bones in place. And then he's got a wound there that needs to be cared for, and then you've got to worry about all the other things, the tendons and the arteries and the nerves that might have been injured as well. So it's much more complex.
Dr. Johnathon Papson's patient, Taylor, is being prepared for major surgery. The 24-year-old surf coach is in danger of losing his leg following a serious car crash. Taylor's badly broken limb is being wrapped in plaster to keep it stable until he goes to theatre.
Trouble is when you lift the leg up, the bone sort of sags a bit, and that obviously hurts. You remember the fracture, there's a jagged bit. So I don't blame him for being uncomfortable. So I can hold the plaster if you want to get the bandage. So you've got the foot. Any lower limb injury that's open to the environment, if it gets infected, you lose the leg or you lose part of the leg. That's the real risk. So there's a risk of infection, and even despite antibiotics and the best possible treatment, it can still get infected. But we just have to have it like that because it needs to be in the right spot.
His dad, Maury, is worried about the impact on Taylor, who's studying environmental science and about to sit exams.
There are some memories in my mind, some pictures in my mind that will stay with me forever. Just below the vehicle, there was this puddle of oil and blood and rainwater all mixed in, and that was just a horrible thing to see. It'll be no different for Taylor, though. He'll have some horrible memories as well.
someone's looking after me. I mean, I saw a picture of the car and it's amazing it's still got legs left, to be honest.
Dr. Jonathan has done all he can for Taylor. He's now going to theatre for surgery to try and save his leg. When surf coach Taylor was airlifted to emergency with a shattered leg from a high-speed crash, Dr. Jonathan was concerned there was a risk of amputation.
If it gets infected, that's big trouble.
Jonathan cleaned and plastered Taylor's badly broken leg before an operation to try and save it. 3.5 months later, the uni student isn't back riding the big waves yet, but he has managed to dip his toes in.
So I went from not being able to take a single step, and then I actually went for my first surf yesterday. So that was pretty exciting.
His leg was saved after marathon surgery, where a titanium rod was inserted from his knee to his ankle.
This experience definitely has changed my outlook on life. I think this accident has strengthened my relationship with my dad. Like, he found it really difficult to be at the accident site and to see me in that situation.
It probably gives us a good outlook on life now. One of the police guys at the thing said to me, you know, someone up there was looking after him, and, you know, we truly believe that.
22-year-old trainee nurse Tale is being rushed by air ambulance to emergency. Tale dragged herself free from her smashed car despite being seriously injured. Passers-by then called for help.
How's your pain? Is it okay?
Dr. Michael Dunn takes charge of the trauma room as paramedics begin their handover.
Okay, this is Tale. Single car accident into a tree. Seatbelt worn, airbag deployed. Self-extricated and then fell to the ground when she realised she had some injuries to her left leg and pain to the left wrist. The ambulance crews bandaged and left the leg in the position found. It was very difficult to straighten it.
Excellent. Tale's come in after a major car accident, quite a high speed. While the knee is quite apparently injured and very deformed, we would mostly be concerned about fluid around the heart, collapsed lung, some bleeding around the liver or inside the abdominal cavity that we don't necessarily see externally. Follow my fingers. Very good. Do you know where you are at the moment?
Yes.
Well, Melbourne.
Sorry, dear. If I press there, is that sore?
Yeah.
That's very sore, is it?
Yeah.
The knee abdominally, is it though?
Yeah. Like, it's to my knee, but it wasn't a couple of
No, sorry, it's not hurt about it.
Just a hard X-ray board, sweetie. Sorry.
Dr. Michael's so worried about Tale's left knee, he orders an immediate X-ray.
Good. Breathe away.
Tell it, is it? From Tale's X-ray, it looks like she's got multiple fractures of her kneecap itself, and it's also penetrated through the skin.
The news is not good. The damage is so severe, it could put Tale out of action for months.
What you do?
Nursing.
Oh, really?
I know, I've got interviews coming up.
Not the side you wanted to be on, is it?
Tale was due to do her final hospital placement in just 3 days' time. Her dream job is now in jeopardy.
They definitely be concerned from a nursing career perspective. Should be on her feet the whole time. Having a knee injury like that may lead to some long-term issues, particularly related to pain. Do you feel me touching the foot?
Yeah.
Good. Can you wiggle the toes at all? Just the toes, good.
Over in Trauma Room 2, Dr. Michael Dunn is assessing trainee nurse Tale's shattered knee. The 22-year-old crashed her car at high speed during her daily drive to her grandma's house.
She's got multiple fractures of her kneecap itself, and it's also penetrated through the skin as well. This will be one of the more dramatic fractures that we've seen. You, with this hand, hold your bad one, and you pin it against your body, okay?
Even though it'll put great pressure on Tale's knee, Dr. Michael needs to roll her to check for other serious injuries.
The knee injury itself, it's very apparent and causing a lot of distress, but there might be something more serious going on. Might be a spinal injury, so we have to keep an overall picture.
1, 2, 3.
Absolutely.
Doing well.
Can you came back down?
No.
Back down?
No.
And can you feel down below? Down here?
Yeah.
Okay.
Taking his like a trip.
I was lucky that the first lady pulled up with a nurse.
Oh, really?
She's on her way to work.
This is all round, I think. All right, we're ready?
Yeah.
3, 1, 2, 3.
Ow.
Yeah.
Is your hip sore?
Nah, my hip's
Ruling out spinal injuries, Dr. Michael now focuses on Tale's broken leg. As she reveals, there was another passenger in her car.
I had my cat in the car.
Oh, the cat. How's the cat?
I ran away.
Probably need to scarf her.
Tale's lucky to be alive, but she's realising the accident could change her future forever. Her precious cat is missing. Her nursing career is on the line, and it's uncertain when, or even if, she'll walk again.
I think Tale is fantastic. I think she's been managing very well. It's quite a traumatic accident to be in, with a lot of unknowns at this point in time, but she's been extremely calm and cooperative.
Dr. Michael's preparing to remove the bandage for the first time to see the extent of the damage to Tale's knee.
Okay. Ready?
Hold it there, is that okay?
Tale's knee is badly fractured, with tiny bone pieces scattered throughout the wound. It's a huge mess that brings new dangers.
The main task we have to do with the knee is immobilize it and also to apply an antiseptic dressing. Unfortunately, we can't leave the knee in the position it's in, which is comfortable for her because the bone fragments themselves sticking out are going to be a high infection risk.
All right, dear, I'm going to take control of your leg, okay? We'll move it nice and slowly.
So Dr. Michael must try to straighten Tale's knee without causing further damage.
Sorry. Just hold it there, is that okay?
They got you.
But she's in too much pain and needs immediate help.
Now put your leg down for a second and then we'll give you some more strong pain relief, okay?
Tale's given a sedative so Dr. Michael can begin the difficult job of cleaning her wound and trying again to straighten her leg.
Is she pretty out of it now? Yeah, okay. It's not much contamination.
Okay. Now, we're just going to try and straighten this slightly, okay?
Yeah, go for it. Does it feel locked or?
No, it feels tight.
It's really swollen.
It's probably straight as we'll get it, I think.
They've succeeded in getting Tale's leg into the best position possible. It's now clear she'll need major surgery if she's to walk again.
We have multiple fragments that we're trying to piece back together. So we'll plaster the fracture to keep it in place, and that will prevent any further injuries, but also will help reduce the swelling and probably give her a better outcome after surgery as well.
Sorry, sweetie, we're just putting a cast on there. Just try and keep your legs straight. I know it's really sore. It'll feel better once we're holding it really still with this cast.
Tale's leg is now set in place to stop any damage before surgery.
So scanner next.
Dr. Michael and his team have done all they can for Tale. She's facing months of recovery and rehabilitation before she can walk again. As his patient leaves emergency to await surgery, Michael can call it a day.
I personally love being a doctor. I am from a family of architects, and I was geared up to do architecture until I watched a season of Scrubs the day before I had to make my decision and then decided that medicine was the way forward. The rest of my family in Ireland have no clue about medicine whatsoever. My dad was a little bit gutted initially, but nice to have someone in the family that can help them when they're sick. And my brother has a little niece now, and I get phone calls probably once a month with questions of rashes and things like that. So I have some use in the family, so they're pretty happy now.
Sorry.
5 weeks ago, Dr. Michael's car crash patient, trainee nurse Tale, was rushed to emergency with severe injuries.
This will be one of the more dramatic fractures that we've seen, with multiple bone fragments sticking out.
Tale then endured a 6-hour operation to fix her ruptured knee. Now, Tale's back on her feet and on the mend.
You're up and walking. The best I can.
Tara and Treen, the passers-by who stopped to help Tale after the accident, have popped by to see how she's doing.
To be honest, you're doing amazing.
To see you walking is just, I wasn't expecting to be able to see her up and walking.
Thank God.
After shattering her knee, Tale thought her dream of becoming a nurse was over.
I ended up still completing all my interviews. I just continued with all my coursework in hospitals.
Oh, that's wonderful news.
Yeah.
That's great.
So that's exciting.
Yeah.
Still going to finish.
What nursing do you want to go into?
I think emergency nursing I'm interested in now.
Oh, that's
right,
wonderful.
Yeah.
And what happened to Tale's cherished cat, Meows, who ran away from the crash?
I saw her run across the road and I just couldn't do anything about it.
We did go looking for the cat, so we did have a bit of a look around, but no, there was no cat.
Yeah,
Is the
so
cat okay?
Saturday morning, a CFA lady picked her up. She was just sitting where I'd crashed and she just caught a glimpse of her eyes.
Oh, wow.
I pulled over and kind of called out and she ran over to her. My lovely Meows. I just burst into tears. I was so happy that she was okay and that she'd been found.